assess the patient and see what their aesthetic goals are, and also whether or not they want to have a smaller implant, the same implant, or a larger implant. It's really a personalized surgical plan for them.
And it seems that every 5 years we get new technology in implants and in the type of silicone, because it seems that there's always new things coming on. So that's why another reason to go visit your plastic surgeon after you see the breast reconstruction results.
Yeah, well, I think breast reconstruction patients see us regularly. So even after they're done with reconstruction, we want to continue to see them to either detect changes or also kind of continue to monitor in case there, God forbid, a recurrence or something like that. So we definitely have our breast reconstruction patients followed pretty frequently.
Now, there are certain risks to having implant surgery, and they've certainly been sensationalized in television shows and all this, that there's migration and all this. How is that usually done preventatively so that the outcome is most of the time, excellent and, what patients want? What is it that you tell patients about expectations and the staging and the recovery of each stage? What can a patient expect when they visit you in your office?
Yeah, there's risks and benefits of any surgical procedure, and part of the consultation is a very in-depth discussion to talk about these risks with the patient. Most of the breast cancer patients are relatively healthy, and most of the risks or complications related to implant reconstruction are mainly aesthetic in nature, such as you can, if you were to have implant malposition that would require an adjustment, if you had a tissue expander that develops some fluid on the outside called a seroma that can be drained. Sometimes they can develop some blood on the outside that would need to be drained, called a hematoma as well. Anytime you have surgery, there's risk of infection, although everything is done obviously in a sterile fashion and the patients receive the appropriate antibiotics. With all those things, I think when you have a practice that focuses on breast reconstruction and that works closely with the anesthesiologist, the breast surgeon, the oncologist, I think a good majority of the patients will actually have a very safe surgical procedure with controlled or minimal risks.
So, in the first stage, where this is the longest recovery, about 3 months, that's when most of the complications could occur that one would expect. Because after that stage, you've already put in the expander and you've already put in the implant. So that's like the major part.
Yeah, the biggest operation definitely is the first one, but we work very closely as a team, and I think it's important to point that out in that we couldn't do this by ourselves. I mean, there's a whole team of breast surgeons, anesthesiologists, hospital staff, nurses that we work very closely with to ensure kind of a safe and kind of seamless experience for the patient. And so I think that's an important point. And obviously the hospitals where we operate at, all the physicians we work with all follow best practices. So patients, in terms of safety, we do everything we can to make it as safe as possible for the patient.
Now, this is considered very safe now for breast reconstruction surgery because now it's approved by all insurances, Medicare, and that happened in a decade ago.
Right. So in 1998, the Women's Health Cancer Rights Act, which is a federal law, was passed, and it was signed into law and became effective in 1999. Over a decade ago. A lot of women still are not aware that that act exists. And what that act does is it guarantees the right that mandates insurance companies to cover breast reconstruction in patients that have had mastectomy, including the contralateral symmetry procedure. So all major insurance companies, including Medicare, do cover breast reconstruction for the patients. Unfortunately, even over a decade later, a lot of my patients still are unaware that that law exists. But the patient education and outreach is improving, and more women are realizing that there's options available for them.
And you also said that people can have this surgery years later.
Right, exactly. So that's called a delayed reconstruction. And we have some patients that at the time of mastectomy or cancer diagnosis, for whatever reason, both personal or medical, decide to just have the cancer treatment first. But then 1, 5, or 10 years later, now as a breast cancer survivor, they reevaluate their body and realize that they would like to have a reconstruction. They can come back in, and pretty much their options are available to them as well, which is using the flap or using the tissue expander. And we'll have to evaluate their tissues to see how they've healed, as well as evaluate their overall medical condition to see what's best for them.
Are certain patients not candidates because of diabetes, hypertension, or other systemic illnesses, or rheumatoid arthritis? Can you tell us a little bit about that? What is not, who are not candidates?
Yeah, so obviously we have to assess the patient's overall medical condition. So if they have a lot of comorbidities that would preclude a safe surgery, especially that would elevate their perioperative risk, then that's a time where you may need to talk to the patient and look at smaller procedures or sometimes even foregoing reconstruction altogether.
And also, probably at the time of mastectomy, the team of doctors, the breast surgeons, the anesthesiologists, all of you discuss, I guess, their medical prognosis, in terms of their staging of their breast cancer, et cetera. What are these procedures eligible for people? What stage of breast cancer? All stages?
Well, the general answer is yes, but obviously in extreme forms of very advanced breast cancer, oftentimes those patients need immediate oncologic treatment, sometimes radiation or chemotherapy before surgery. And in those cases, oftentimes the priority may be shifted to focus on the oncologic treatment. But now with screening mammography, more and more breast cancer is being detected in earlier stages. And those patients truly have options to have both a good oncologic result and a good cosmetic or reconstructive result. And those are, I think, the patients that would benefit most from having the immediate reconstruction.
Now, in America, in Europe and America, are we the leading, are plastic surgeons performing most of the surgeries, this type of surgery in developed countries, or it's now worldwide, the breast reconstruction?
Yeah, I mean, this is the techniques that we have are international, and there are centers that do and advance the field of implant and microsurgery, flap reconstruction all around the world, especially more so in the developed nations, because obviously there are some resources and technological advancements that need to be available in order to do those procedures, especially some of the more advanced procedures safely. And those resources just may not be available in some of the more developing, may not be available in the lesser developed nations.
Now, the take-home message for our home audience, what do you think are the few points we should remind our audience about breast cancer and breast cancer reconstruction?
I think with the diagnosis of cancer, oftentimes there's an overwhelming anxiety and fear that women can have. But I think the important thing is that, and we see those because oftentimes because we work closely with the oncologic community, at the time of the diagnosis, that's also the time where we're able to have them come to our office to talk about the reconstructive options. And we see how the patients really take that visit as very helpful to them because they're overwhelmed and fearful, but when they hear that there are these reconstructive options available, that patients have done well and can both look good and also have a good cancer treatment, they feel a sense of hope and they feel some alleviation of their fear. So the take-home message is that breast cancer in this country it occurs in 1 out of 8 women, but there are options for you, and it's important to speak with a plastic surgeon. They can sit there and talk to you about these options and help you.
So the take-home message for the home audience is, after breast cancer surgery, there is hope for, breast cancer reconstruction surgery, and that there is a stage procedure that is safe, and that the outcomes are excellent, and to have the general surgeon and the plastic surgeon be among your team of specialists at the time of diagnosis. Well, thank you, everybody, for joining us on Health Talk. And if you like our show, call KSAR Television and make a donation. And thank you very much, and we hope to see you again.